Ontario has announced big changes to the way it treats people addicted to drugs. The government is restricting safe consumption sites and will instead spend hundreds of millions of dollars on treatment and rehabilitation. The discourse around supervised consumption sites is often politicized, and the science gets lost in that. And so for that, let's bring in Canada Tonight's medical contributor, Dr. Samir Gupta. Dr. Gupta, good to talk to you.
You too, Sarah.
First of all, had any of these supervised consumption sites, do they work, do you think?
You know, as you say, it's been politicized and lots of people have different opinions about them, but let's talk a little bit about the science. And first, just conceptually, you know, the idea here is harm reduction. Harm reduction is somewhere in between, the best and the reality. And the best is that everybody just stops using and stops becoming addicted overnight. The reality is that people were using in the streets, people were dying of overdoses, and that continues to happen, and we have an opioid crisis. And so harm reduction is acknowledging that people will use, but it's saying let's give them a safe space where they can use, and let's use that as an opportunity to plug them into the system where we might be able to help them to quit. And so it really is a physical space where people go in, they have access to clean needles, so that's important because it reduces exposure to things like HIV and Hep C. They have access to specialized personnel that can treat them with Narcan if they have an overdose. They have access to testing kits. They can test their own drug supply to see if it's, for example, laced with fentanyl, which is one of the causes of death for drug users right now. So that's the concept here, and there's lots of science to show that it does work. Science from Canada and other parts of the world consistently show, first of all, that it saves lives. So you have a study from BC showing that users who go to these sites are less likely to die than users who don't. There's a study out of Vancouver where it was the first site in North America. It's called Insight from Vancouver, and they showed that within 500 meters of that site, there was a 35% drop in overdose deaths compared to a 9% drop in the rest of the province. Studies show that people are less likely to have overdoses. People are more likely to get plugged in to the social support network and ultimately more likely to quit. You are less likely to have usage in public spaces. You're less likely to have paraphernalia in public spaces. You're less likely to have those infectious diseases that come with shared needles. All of this has been demonstrated by multiple studies around the world.
So, Dr. Gupta, what happens if these sites go away?
Yeah, I think there's an unknown there around what happens. And I think people think that folks are in these neighborhoods and are using because the sites are there. But in many ways, it's the opposite. We can't forget that sites are, in fact, selected and located on the basis of where users are. The problem exists. People use these drugs, and the sites are there for those users. So you take away the sites, you won't necessarily displace the users. Likely the users will continue, but they will use in many cases in public spaces. You will find more paraphernalia, so it's almost the opposite of why people are worried and concerned about these sites. You may actually see more of that. And the users will likely have more overdoses. You will likely have more deaths from contaminated drug supply. You'll have more infectious diseases. All the benefits will start going away. You will also probably have more burden on the healthcare system. There are thousands of overdoses that are treated at these centers every year, and where will these folks go? They will end up in the emergency room. They will end up in our hospital system at a time where our hospital capacity isn't very good. So all of these knock-on effects.
The Ford government is saying that they're going to create heart hubs, H-A-R-T, which will not offer supervised drug consumption or even needle exchange programs. Instead, that they want to prioritize treatment and recovery. And that certainly sounds good to anybody who is hearing that. Do you think that's an effective strategy?
The heart hubs are part of a larger investment. The government should be applauded for an investment in addiction services, counseling, in beds for people who have addictions in hospitals. But as you said, it doesn't offer some of the elements of supervised injection sites that make them unique in terms of clean needles, in terms of, for people who will use, who want to continue to use, a safe place where we can help to prevent overdoses and make sure their supply is safe. So many of those other benefits we just won't see. And again, it's a way to get people to come into an environment where they feel safe and they can then access those same services that you might have in a heart hub. So will they access them without the rest of the benefits of those supervised injection sites? Unknown, but from what we have so far, from what we know so far, conventional programs like that are just not going to be as successful at helping these folks and ultimately helping many of them to quit, to stop using.
Canada Tonight medical contributor, Dr. Samir Gupta. Dr. Gupta, thank you so much.
My pleasure.